Hey, this is Dr. Carter. Thanks for coming back. This video is basically going to be entitled My Personal Story with Genetics and how I got involved with genetics and my passion and why I am an advocate for genetic testing, okay? It all started in 2009, and right now we're sitting halfway through 2016. It started with my daughter, who was right at 2 years old. My little sweet daughter, and you know, we all have the best daughters that there are, and your daughters are no exception. Neither is mine. So, but me being in healthcare, and her mother's a nurse, and now is a nurse practitioner. She nursed our daughter, and did for the first 18 months, 20 months, and then we decided that we weren't going to put her on the old bad cow's milk, but we're going to put her on soy milk. All right, so we do so, and looking back on this, you can almost kind of read into where I'm going, but I want you to listen to the story, and I want you to really understand why I am an advocate of people getting their genetic tests. Okay, so we put our daughter on soy milk, and think about it. A couple of months go by, and then all of a sudden she starts having some gastrointestinal problems, a lot of diarrhea. And we just couldn't figure out why. So we called our trusted pediatrician and made an appointment to go up there, told her what was going on. She said, we see this often with kids, about this age, and here's some medicine to take for that. And our question at the time to the pediatrician was, well, why is it happening? I mean, what's going on? Well, her response was, it's an immature bowel. And I thought, all right, why does she all of a sudden get an immature bowel at 20 months of age? We're really not sure. But this medicine should help clear it up. So, okay, here we go. So we take the medicine, and she clears up about 50%, And if we take her off the medicine, comes right back. So I'm thinking, the medicine's not the cure-all. There's still a problem there. So we go back again, a couple weeks later. Well, if we keep her on the medicine, she's like half better. Docs, what do you think? Well, let's up the dose. Okay, so we up the dose. And again, and I didn't go to that appointment, but my wife said, what do you think's causing this, Doc? It's just an immature bowel. We see this quite a bit with kids, and we have to go through a couple courses of medicines to find out what medicine works best for them, and that usually takes care of it. And then they may have to stay on the medicine for a while. So my wife calls me, and I'm at work, and she tells me, and I'm thinking, there's a cause for this. Why? I want to know the why. Okay, you're going to understand that watching my videos, because I'm going to explain the why. And a lot of times the why is over our heads. But I'm going to try to take the difficult why and explain it to you so that you can understand too, so that you don't have to go through situations that I had to or other people do. So as time goes by, same thing. We do the double dose basically of medicine, and maybe she gets 60% better, not a lot. Call a buddy of mine, cardiologist, and say, hey, who do you take your kids to? Me and my medical friends, this is the group that we take our children to, and they're really, really good. Oh, good. All right. So we call, get an appointment, get in. Wife takes the baby up there, and she's probably 26, 27, 28 months old at this time. Okay, been on these meds. Things just really haven't gotten a lot better. We're concerned because with diarrhea, you're not retaining the fluids that you need to. You're losing electrolytes, and you just don't want your baby to have to go through that stuff. We know it's bad. We know they're not retaining things they should be, and the good nutrients that they need to be absorbing in the small and large intestine. So we go to this specialist in pediatrics and say, hey, this is what's going on. We've been to our doctor twice. What do you think? Does an exam. Immature bowel. That's what's going on with her. She has an immature bowel. And my wife says, well, what's causing the immature bowel? We don't know, but we see, quite a few kids with it, and there are, medicines that we have to put them on, and some medicines work better than others. We'll just have to do a trial start with this particular medicine to see if that won't help clear up. What's causing it, Doc? My wife asks. We really don't know. It's just something she's going through a growth spurt, and we just see this, and we just don't know. But if you'll take this medicine, then things should clear up. And we're not anti-medicine people. I mean, she's a nurse. She's given medicines for 20 plus years. And I'm not an anti-medicine person whatsoever either. So we were just scratching our heads going, there's a reason behind it. it's more than just an immature bowel. Now she's a nurse practitioner, so she's a very, very smart lady, and it just wasn't making sense with her or me. So I call a friend of mine, and he's a doctor in Dallas, Texas, and he says, you need to get a hold of Dr. Kenneth Fine. He's a gastroenterologist, and he runs a genetic testing laboratory in Dallas. So I did some research on Dr. Fine, and he had written many articles for the New England Journal of Medicine on gastroenterology. And I get a hold of the lab and look at his bio, and I thought, yeah, this guy's on top of it. He's a medical professional. He knows what's going on, and we're going to do this lab. So we do basically a 6-gene panel, and it was right at $600, and it was a stool sample. So we had to take a stool sample. They send us the packaging. We send it down there. And within about 10 days, they send a report back to me. Nice little report, but basic. In it goes through some of the each of the 6 genes that she had been tested for, and it tells us if she has what we call a negative or a positive allele, A-L-L-E-L-E, okay? So what we're looking for here in these alleles, we're looking for negative, negative. That means things are good, okay? Negative, positive means we've got somewhat of a problem. Positive, positive is no good, okay? So I'm going through this genetic report, first time I'd ever seen one in my life, 7 years ago, and I'm reading this report, and it gets down to where it says soy. She was positive for the gene related to soy. And in the remarks it said, must maintain lifetime absence from soy products. And I thought, soy products? She drinks soy milk most all the day in her sippy cup. That's what she has. And I thought, man, could it be that? I mean, did the genetic test really find that that's the problem with our child? So, print off the report, show my wife, we look through it, and she said, we've got to do this. And I said, well, yeah, we've got to. So we take her off soy milk. And this is no over-exaggeration whatsoever. Within 2 days, we've seen a little bit of improvement with her stool. Within 3 days, more. Within 5 days, quite a bit. And within about a 7-day period, she had perfectly normal stool and has ever since. We took her off soy. That was her problem. That was the cause of her immature bowel. It wasn't an immature bowel. She had a genetic homozygous gene that says this girl can't eat soy. When she eats soy, her body is going to reject it in the form of diarrhea. That's what happened. So in my mind, I'm thinking, how many of these kids have been to different physicians, pediatricians, or whomever, that have just been prescribed medicines because of an immature bowel? It kind of bothered me. No, it bothered me a lot. So we have a follow-up visit with our original pediatrician. We go in. I didn't go to this visit. I was working, had patients. So the pediatrician asked my wife, well, how's your daughter doing now with the new medicine? Well, she doesn't even have to take the medicine anymore. Oh, that's great. Good, good, good. Wife goes on to explain, yeah, well, we found a gastroenterologist an MD gastroenterologist out of Dallas, Texas, who does genetic testing. And so we had genetic testing. We found out that she is homozygous positive for soy, which means she has to avoid soy all of her life. And when we did that, Doc, within 7 days, she had no problems. We took her off the medicine. She's not been on the medicines now for about 4 months, and she's doing great. So, do you think that the pediatrician, I hate to say this because I have some awesome friends that are in the medical field that do medicine and prescribe medicine on a daily basis. So I say this directed at the whole and not the individual. But the doc didn't even ask a question about more information about Dr. Fine. What kind of genetic test was it? That's awesome that you found this out so she doesn't have to take medicine anymore. I would like to find more about this myself so I could have this option to offer my patients who come in with the same condition as your daughter did. Not once. Didn't ask, didn't care, didn't mention it. And the wife said she almost acted like she was offended that we did this and she didn't know anything about it. And at that point in time, after I found that out, it burned me up to think of all the kids that go to different doctors and are prescribed medicines because nobody knows what's going on. We think this is what's happening. We don't know. Physiologically, we can't prove it. Biochemically, we can't prove it. Genetically, we can't show it. We don't understand it. But take this medicine, and we're hoping it works. And again, I'm not anti-medicine. Don't get that with me at all. I'm anti-guessing at what's going on with your health care. Okay? Well, we guess it's this, so we're going to try this medicine first. If that one doesn't work, we can get you another medicine. And if that one doesn't work, we'll get you another medicine. In genetics, there's also pharmacogenetics. And you can have the test done, and it will give you the medicines that work best according to your genetic profile, so there's no more guessing to begin with. Okay? We were fortunate. We found out the cause. We eliminated the cause. And we had great results. And she's never had a problem since. She's 9 years old. Had her 9th birthday a couple weeks ago. She had no problems with that. Okay? So this just goes out to you guys to let you know why I'm an advocate of genetic testing. After you've been told we don't know why, we can't find the answer, we can't find the cause, we don't know, our best people are on it. If you've not had the proper genetic testing ran, you're missing a whole nother boat. And folks, I'm here to tell you, I'm so fortunate to have ran into Dr. Kendall Stewart. He's an MD, he's a neurologist out of Austin, Texas, and we use his genetic test. He's the one that developed it after a lifetime of seeing patients and over the last dozen years seeing chronically ill patients and using their genetic report to help those people get better because they couldn't find anything on the MRI. They couldn't find anything on their blood lab. They couldn't find anything on the CAT scan or the CT. Why don't we use their genetics? Let's look at their genetics and find out what's going on. Let's look at the biochemistry of their body based on their genetic profile and go, okay, here's the problem. Let's work on that. Okay. Now, for my videos, probably almost every video that you're going to see with me, I'm going to mention my story with my daughter and how I'm an activist. So those of you that have seen this video, you're going to understand that. I'm not going to go into it every single time, but you'll know why now I'm an activist for getting your genetic results, okay? Getting your testing done. And these aren't doom and gloom genes. He's not testing for cancers and tumors to see if you have the BRCA1 or BRCA2 breast cancer gene. He's not testing to see if you're going to have an astroglioma type of a tumor on your brain, okay? Those aren't the things that he's testing for. He is testing for common, chronic disease symptoms that can be fixed using correct biochemistry based on your genetic profile. Okay? So he's not a disease fixer. I'm not a disease fixer. I don't fix diseases. I look at your physiology, I look at your biochemistry and your genetics and put those together based on your genetics and your biochemical pathways to find out what's going on and what you need to do to overcome that. Okay? Educate yourself. That's what it's all about. Educate yourself. Know that there are other ways to find out why you feel or why a family member or why a child feels the way they feel. Okay? Anyway, Dr. Carter, thanks for listening to this. I'm an advocate, and now you know why. Thank you.